as Sabi Doctor, is a Lagos-based practicing medical doctor, speaker, health influencer, and award-winning health educator. He's a two-time recipient of the Social Media for Social Good Awards, which he won in 2019 and 2020. Dr. Damian is an alumnus of the prestigious College of Medicine, University of Lagos. He's also the founder of Pregnancy Aware, which is an online platform and solution for improving pregnancy outcomes through educational interventions, and risk management. Dr. Eva is fueled by his passion for health literacy and wellness, and is currently the author of 5 books. Join me as we welcome Dr. Eva to have his presentation. Dr. Eva, you have the floor.
Thank you so much, Ezine. Thank you, thank you. It's a pleasure to be here. It's a pleasure to be here. Hello, everyone. Good afternoon, ladies and gentlemen. It's a pleasure to be here to talk about this topic. And before I pull up my slides, I think it was just, I think last 2 weeks that we heard of the story of a very popular music video director who suffered a kidney transplant failure. And of course, as it usually happens in our environment, when events like that come up, you know, people start talking about kidney-related issues. So I think the time is perfect for us to have this conversation as people are still, their consciousness is still receptive to anything related to kidney health. Okay, I think we can start now. I've been told I have 20 minutes. Kidney is a very voluminous topic, but let's try and see if we can fit everything within that time frame. So I will be pulling up my slides now. Just let me know once you have it on your screen. Okay. Okay, just a minute. Okay, just a minute, please. Just a minute. No, that was not it. Does it allow PowerPoint share? Please, can you confirm to me, Ozine? Ozine, can you confirm to me if it allows PowerPoint share? Otherwise, I will just have to use the...
Yes, it does.
Okay.
Yes, it does.
I'm trying to pull up my PowerPoint and it's, it's telling me it's not supported. Still the same thing. Okay, just give me a minute. Let me pull up the PDF instead. Okay, just a minute, please. Apologies. Okay. Done. Just a minute, please, ladies and gentlemen. Okay.
All right, so please, while we wait for Dr. Damian to get his presentation up there, we did like you to follow us on all our social media platforms, on Twitter, Facebook, Instagram, and we are there as SynLab Nigeria. Also like you to subscribe to our YouTube page, which is SynLab Nigeria. And so again, before the end of the webinar, there will be a Q&A section, so feel free to use the chat box to drop in your questions.
Please, can you confirm to me that you can see my slide? Should be up right now. Lifestyle and Kidney Health by Dr. Damian Avra.
Yes.
Awesome. Okay. So let's start the lecture. I'll be taking questions at the end of it. So if you have any questions, you can just note them down, and then at the end of the lecture, I will try my best to answer as many as possible. Okay, so for those who may not know what the kidneys look like, this is a pictorial representation of the kidney. these are the human kidneys, you know, looking very pink or reddish brown. That's the color, reddish brown, being shaped. That is what the kidney looks like. All right. Now, of course, this is the diagram showing the left and the right kidney. Okay. This is what the kidney looks like. But before we get to the substance of the discussion, which is on lifestyle and your kidneys, let's learn a fact or two about the human kidneys. Now, of course, we know that the kidneys are a bean-shaped reddish brown organs. Each one of them weighs about 150 grams each on average for the average human adult. So if you add the two of them, you should be getting about 300 grams for the average sized human adult for the two kidneys. That's for those who have two kidneys. All right. The kidney is located below below and under the rib cage. I have a diagram to show you. This is what it looks like. So you can see that the kidneys are just underneath the rib cage, with each one of them on the side or to the side of the spine. More clinically, we refer to them as being retroperitoneal. They call it the retroperitoneal location or space. That's where they are located. All right. But then there's something I needed to point out here. You can see that the right kidney appears to be placed a little lower than the left one. And that is primarily because of the liver, the location of the liver. This particular arrangement is normal. In case you are wondering, it's perfectly normal. Okay. Another interesting fact of the kidney is that the kidney is a vital organ. What are vital organs? Vital organs are organs of the body without which survival will not be possible. So you are talking of organs like the brain, the heart, the lungs, alongside the kidney, the liver. These are vital organs. In other words, their functions are too important without which survival will not be possible. So if for whatever reason the kidneys go bad, as it can happen in many cases that we are familiar with or has happened, survival can become very difficult unless the person is placed on dialysis, weekly dialysis, or the person gets a kidney transplant. Okay, so the kidneys are vital organs. In addition, okay, just a minute. In addition, the kidneys receive about 20 to 25% of the blood that comes out from the heart when the heart beats. This is very important because this alone makes it possible for the kidneys to filter about 200 liters thereabout of blood daily. All right. Okay, just a minute. Just a minute. Somebody wanted to project it. I think some people are complaining about the size. Is this better now? I've just increased the size now. Is this better? Let me see if I can send the...
No, it's not better. Please, can you send your presentation to Dr. Ike so that he can share?
Okay. I will do that
Thank
now.
you.
I'll do that right away. Okay, just a minute. All right. Just 1 minute. Okay. All right. Dr. Ike, if you can hear me, I have sent the PDF to your WhatsApp. Okay. Let's get back to the lecture. Should I wait for him to project before I continue, or I can go ahead with the...
Yes, please, just give us a minute or two. He'll project soon from his screen. Hello, everyone. Apologies for holding on. We're trying to project his presentation so that we could see it better and engage more. And then again, please don't forget to follow us on all our social media platforms on Facebook, Twitter, and Instagram. Also subscribe to our page on YouTube, social as Synlab Nigeria. Feel free to also drop your questions on the chat box. Thank you.
So isn't it, once it projects, I think I can take mine off. Is that fine?
Yes, that's fine.
Okay, so people can see my face. Okay. All right. First thing I tried to open the PowerPoint. Let's say something else.
Okay, well, we have it on the screen now, Dr. Dimian, so you can continue.
Okay, that's fine then. Okay, all right. So can we just go to the, I think, fourth slide, I think. Okay, here, we are still here. All right, so I was making the point that the kidneys receive a very high amount of blood flow, about 20 to 25% of the cardiac output gets to the kidney, which makes it a very vital organ since it filters about 200 liters of blood daily. But another interesting fact about the kidneys is that the kidneys are a paired organ. What does that mean? It means the exact replica that you have on the left is the exact of what you have on the right. What the left kidney does is the same thing the right kidney does. All right, that's what we call a paired organ. Just as you have the ovaries in women, just as you have the testicles in men, or the lungs in people. And the beauty of the kidney being a paired organ is the fact that oftentimes people can survive with just one kidney. If that kidney is actually healthy and functional, people can do well with it. And of course, it's the reason why somebody can donate one of their kidneys and still be perfectly fine, because we can survive with just one of our kidneys, as long as it is functional, as long as it is healthy. Okay, now let's get to the function. What are the functions of the kidney? Next slide, please. Why so much noise about the kidney? Next slide. Why so much noise about the kidney? Now, the two important functions of the kidney that makes it a vital organ, one of the vital organs of the body, is the function of excretion and the function of water-salt balance. Of course, you also have to consider other functions like hormone production, vitamin D synthesis, which is important for our bones, red blood cell production, blood pressure control, and the likes. But when it comes to it being a vital organ, the function is narrowed down to excretion and water-salt balance. What is excretion? The removal of waste products. So you have a lot of metabolic reactions that are taking place or processes taking place in your body. At the end of the day, byproducts are released, metabolites are released. These metabolites, some of them can be toxic to your health, except they are expelled. And that is where the kidney comes in. So in working alongside the liver, the kidney is able to filter the blood and remove toxins, waste products that are not beneficial for the body. And then it eventually empties it through the urinary system, the ureter, it gets to the bladder, and from there, the person pees it as urine. All right, so the urine that you produce is actually waste products that the kidney was able to filter out of the body. So that particular function is very important, because that's how it's able to filter toxins and other toxic metabolites. Same thing with water balance. There is an ideal level of water that is needed for optimal functioning of the human system. If you get above that, it's a problem. If you get below that, it can become a problem. Same thing with our salt. So it is possible you can have too much salt floating in your system. It is also possible you can have too little salt. It can become a problem. So the kidney is able to address this issue through a network of cells, millions of them. Each one of them contains a single kidney has about 1 to 1.5 million nephrons that work round the clock to keep the filtration and the excretion function of the kidney going. Okay, so if you are considering the kidneys as a part of the vital organs of the body, you must tailor it to these two functions, excretion and water salt balance. As a matter of fact, there is a slide here. I think is the slide, the third slide after this one. Can we just take a quick look at that? There is a slide I wanted to show to you that emphasizes the importance of the water salt balance of the kidney. Can we get to the I'm waiting for the slide to be moved. Okay, let's move, please. There is a slide I want to emphasize. Maybe I should, okay. Okay, yes, to the next one now. Yes, so when I was talking about the water salt balance, this diagram here is a consequence of when the kidney is not able to perform that function. This is what we call pitting edema of the feet. All right. Ideally, the kidney should be able to excrete excess water, but when the kidney is diseased or the kidney has failed and is unable to perform that function, you have excess water floating in the tissue spaces of the body. So you can have this experience. And by the way, it's not only the feet that gets affected. You can have this swelling in the face. You can have it in the hands. Sometimes there is accumulation of water in the lungs, or called pulmonary edema. This can become very problematic. So this particular slide is just emphasizing the important role of water salt balance that the kidney plays. Can we get back to the point where we were previously? And then we continue from there. All right, not here. The next one, and then we begin. The one before this. All right, yes, we can start from here. So the question of whether or not the kidneys are needed for you to be healthy and happy cannot be debated. Nobody should debate it. It's already confirmed that your kidneys are needed for you to maintain steeze and composure, as the next slide emphasizes. So if you need to maintain steeze, you need to maintain composure, you need to have healthy kidneys. No healthy kidneys, no steeze, no composure. You will lose your steeze and composure very quickly. In fact, it will take a few days. And if you are not lucky, let's say your kidneys are failed to the point of you needing dialysis or renal transplantation, kidney transplantation, and you don't have access to either of them, it will take a few days, maximum a few weeks before you get smoked. So the kidneys are important for a healthier and happier life. Next slide, please. I think I've explained this already. You need healthy kidneys to maintain steeze, composure. Now, this particular slide is emphasizing the different stages of kidney damage. And it's important because I'll emphasize something towards the end of the lecture when we talk about prevention. There are stages of prevention, okay? But of course, in stage 1, the kidney is working perfectly. Even the color attests to the fact it's looking reddish brown, very beautiful. And you can see that as the damage continues or ensues over a period of time, you see progressive degradation of the contour of the kidney. It gets darker, it loses its function. And by the time you are getting to stage 5, that is the point where we call it end-stage renal failure. Obviously, at that point in time, the person will need either dialysis weekly or the person will need a kidney transplantation. Next slide, please. Okay, yes. Now, let's start with diet. So we are going to get to the lecture proper now. Your lifestyle and your kidney health? Is there any nexus? Is there any relationship between how you live and the health of your kidneys? For example, if you drink a lot of alcohol, will that affect the health of your kidneys? By the way, when we say lifestyle, this is your predominant way of living. So the thing you are doing, like you do repeatedly, does that have any bearing on how well your kidneys are going to turn out? And the evidence says yes. So there are several of these lifestyle factors, but we are going to start with diet. And as we know, someone wise said that we are what we eat. And this is true for your kidneys as well. Is there a problem with the audio? Somebody just complained in the chat box that they are having some trouble hearing. Isn't it? If you can hear me, can you confirm? Okay, all right. So I think it's my audio is to the fullest. Okay, so I think it's either from your side, those of you who are having difficulty hearing. Okay, so let's talk about diet. How does diet affect kidney health? This particular slide is showing a report I pulled up from PubMed Central. Is one of those repositories of clinical investigation studies where you can find a lot of the studies. And this one just highlights a summary here. Healthy dietary patterns are associated with a lower risk of CKD. CKD is chronic kidney disease, and the report went on to say that more research is needed into the effect of specific food groups and beverages on kidney function. So there is no question that what you are eating, the 10 pieces of meat, of red meat that you eat with 2 wraps of fufu, may have a bearing on your kidney health. Of course, in our part of the world, we call it enjoyment, evidence of good living. All right, but if you look at it forensically, you might be able to understand that that food you think you are eating that is, that qualifies as enjoyment or evidence of good living, that might be injuring your kidneys. And by the way, it's not only the kidneys that are involved here. You have your heart, you have your liver, you have your brain. Okay, so diet play a very fundamental role in the health of your kidney. So when you ask the question of the effect of diet on the kidney, one area that needs emphasis is on the area of, so what type of food will you say is kidney friendly, or what type of food will you say is kidney or friendly? The next slide will help us emphasize or answer this question. Please, can we get to the next slide? Okay. So this one is just emphasizing, you can see the guys on the left, see them, they drink a lot of beer, they eat a lot of junks. You can see how obese they are compared to the people on the right, the forms on the right. They are looking lean. Their organs are within reasonable limits. By the way, do you know that if you are obese, you are also more likely to have a larger size kidney, and your kidneys are more prone to stress or strain because they do a lot of more work. So the fact that you are obese is already a risk factor for kidney problem. Okay, it's already a risk factor for kidney problem. Next slide, please. Next slide. All right, so these are some of the foods to be mindful of if you are considering healthy dieting. You want to go very easy on salt. Unfortunately, in our environment, we love salt so much. We are frying dodo, you have to put salt. You are cooking maize, you have to put salt. And this salt is a problem. Interestingly, after you have consumed salt from all of these homemade food, you still go and consume a lot of salt from the processed foods that we buy from fast food joints. Salt is a major problem because salt can predispose you to hypertension, and hypertension is a serious risk factor for kidney damage, right? So in addition to salt, you have processed meals, heavily processed meals, including meat, fast foods, processed foods, foods that are generally over-processed. are not so great for the body. They can predispose one to developing hypertension. They can predispose one to developing diabetes, which are all risk factors for kidney disease. Another important one is alcohol. You know, alcohol has both direct and indirect effect on the kidney. If you are drinking a lot of alcohol, that is a problem. It can become a problem. It can injure your liver, it can injure your kidney. So you also have to be very careful on alcohol. Luckily, there is a safe limit of alcohol intake for those who already have healthy liver, because there are some people who should not even get close to alcohol. If your kidneys are already bad, please don't near alcohol at all. But your kidneys are still working fine, you can do a safe limit of alcohol intake if you cannot completely abstain. Sodas, energy drinks, canned foods, and then there are some fish. Generally, fish is fine for the kidney, but there are some fish that are high in mercury, also some fish that are high in phosphorus. So fishes like the king mackerel or the swordfish, these are fish that are high in mercury, including shark. So if you are into shark, you eat a lot of shark, please be very careful because they contain abnormal levels of mercury that may be poisonous to your kidney. Next slide, please. Next slide, next slide. I think we're done with food. So you know about food now. The next one is water. How important is water to the kidneys? Again, this particular slide emphasizes how important water is to survival. The average man is made up of about 65% of water, the average woman about 60%. Now, these are their individual, so when you take the individual organs of the body, like the brain, the kidneys, the lungs, the eyes, you can see their individual composition of water. The brain, 83%, the heart, about 75%. Look at the kidneys, 83% is made up of water. What this slide is saying essentially is that you need water to survive, not just water, adequate amount of water. We don't take, okay, let me hold that thought. But the point here is that water is very, very important. So you need to be sufficiently hydrated, especially during weathers or during days when the weather is quite hot. All right, when the weather is quite hot and you sweat a lot or you lose a lot of water, either through respiration or through sweat, you need to hydrate adequately to keep your kidneys well irrigated and flushed. It can help with prevention of kidney stones. All right, so water is very important. Let's go to the next slide, please. I'm trying to be mindful of time. Now, you can know whether you are well hydrated or not by just looking at the color of your urine. Now, there are some disease conditions that can affect the color of your urine. There are some drugs that when you take them, they can affect the color of your urine. But generally speaking, if you notice these colors in urine and you're not taking any drugs or they cannot be explained by anything else, it could be a sign of your hydration. All right? It could be a sign of your level of hydration. So if you are well hydrated, you want to notice a urine color that tends towards the left. So the light yellow towards the yellow part, that's indicative of sufficient hydration. By the time you are getting to amber, by the time you are getting to red, you are getting to brown. By the time you get to brown, that is indicative of dehydration, you know, because the urine is very concentrated. So by looking at your urine, in fact, after this lecture, go take a pee. You can be able to tell whether or not you are taking enough water. And if you are not taking enough water, the next thing to do is to make sure you hydrate adequately. But then somebody may want to ask, Abi doctor, what is the right amount of water to take? Let's see that in the next slide, please. All right, for the average adult male, generally speaking, and this is a universal standard, you can do about 3 to 4 liters of water daily. For the female adult, you can do about 2 to 3 liters of water daily. But again, you also need to understand that your intake of water is dependent on a number of factors. So for example, your age matters. Children cannot take 3 liters of water daily. You are going to poison them. There's something we call water poisoning. All right. Then the weather too. If you are if you find yourself in a very hot climate, the sun is out, you are sweaty, you might need to take a lot more than the average. Compare that to If you compare that to raining seasons, you notice that you drink less water and your urine tends to be lighter, more clear during the raining season. Okay, so there are factors, even medical conditions. There are some people who have medical conditions like heart problems or kidney related issues that will not do very well with 3 or 4 liters of water daily. Okay, so while you are at it, please make sure that your state of health allows you to go up to 3 or 4 liters. But before we leave this slide, something very important I should mention is the fact that if at all you are doing 3 or 4 liters, I've met some people who do 5 liters, who do 6 liters. It's important you spread out the intake of the water. So you don't carry 2 or 3 liters of water and drink within a space of 1 hour. You are setting yourself up for problem, because there is something we call overhydration or water poisoning. It's possible you can drink water to the point where it poisons you and you can die. This is not me wishing you bad, but it happens. All right, somebody can die from overhydration. So the target is that you should not do more than 1 liter per hour. If at all you are going to hydrate with about 1 liter per hour, except in very peculiar cases when you need very aggressive rehydration. Okay, next slide, please. Next slide, let's talk about the physical activity aspect of kidney health. So another research study here showing how important exercise is for kidney health. So we know that exercise improves many of the risk factors associated with the development of chronic kidney disease. All right, so the more active you are, reasonably and moderately active you are, the less likely you will develop kidney disease. And by the way, this dovetails into the risk factor of sedentary lifestyle. Sedentary lifestyle is a risk factor, a serious risk factor for a lot of conditions: diabetes, hypertension, kidney failure, or even death. What is sedentary lifestyle? A lifestyle that involves you sitting or being immobile for most of the daytime part of your day. All right? So from morning till night, you are probably maybe seated or you are not active. You rarely stand up, or that's what we call sedentary lifestyle. We know that is a risk factor for diabetes, heart conditions, hypertension, and even kidney disease. So you may want to pay attention to physical activity. What are some of the physical activities to look out for? Can we go to the next slide? Next slide, please. Very quickly. No, before this one. So yes, first things first, you need to know how much of exercise you need. Minimum of about 150 minutes of moderate intensity exercise per week. You can spread that out daily for 5 days, 30 minutes daily for 5 days, or 75 minutes per week. Just a single episode of 75 minutes vigorous exercise per week can offset that particular risk. Exercises like brisk walking, water aerobics, cycling less than 10 miles, these are all on the moderate intensity. By the time you are cycling more than 10 miles, you are running, you are doing a sprint, aerobic dancing, push-ups, weightlifting, digging. These are all under high intensity exercises. Whatever gets your heart beating a lot faster than normal, you can qualify that as high intensity. There is a way they calculate it. I will not bore you with the technicalities. Before we go to the next slide, caution should be exercised when you are considering exercise. Why is this important? You can over-exercise to the point of injuring your kidneys. There's something we call rhabdomyolysis. So some people just start exercise today. You have not been exercising for 5 years. Then for some reason you get the inspiration and you want to go to the gym and lose 5 kg in a day. And you exercise to the point your muscles become sore. What are you doing, sir? That's not how it works. Moreover, apart from the fact that you are going to get your muscles feeling sore, you can put yourself up to suffer a complication of overexercising called rhabdomyolysis, where your muscles can break down and release protein that can get to your kidney and cause kidney damage. So overexercising can damage your kidneys. Underexercising is not good. Overexercising is not good. Just try and get a balance. You can start out gradually, and as you build stamina, then you can improve your pace. Okay, very, very important. Those of you who lift a lot of weight in the gyms, please, this is for you. All right, next question. Next slide rather. Stress. I believe Lagosians will easily agree with this one. If at all you have been having issues with the previous slide, you understand this one. Stress. I want to believe every Lagosian is stressed around the clock. Look at the route when they are driving. The rage is from stress. Somebody is waking up by 4 a.m. to get to work to meet up a 7 o'clock or 8 a.m. resumption time. You are stressed. You get back home by 10, you sleep for maybe a few hours. You are persistently stressed. And then the economy is also not smiling. Some people, the stress is financially induced. There's a lot of stress. Every Nigerian is angry. And as you are angry, and your stress hormones and the stress, they are all over the place. You can develop hypertension. All right? It can affect your mental health. And the thing with stress here is that if it is not well managed, stress in itself is not terrible. It's when it becomes very unmanageable. That's when it is destructive, because we need some level of stress every now and then to achieve our goals. That's fine. But when it is persistent, it is not is becoming injurious to our health. That's a problem. So you should learn how to manage your stress. It can affect your mental health. Your mental health can also make you if your mental health is not sound, you can take decisions that can negatively damage your kidneys, right? So mental health, the combination of stress and mental health is very, very important. This is just a study emphasizing the importance of stress on kidney health and other aspects of our health. Next slide, please. Okay, so we are almost done. We are almost done. So we have said a lot of, we have used a lot of big words to explain stuff. We have talked about kidney failure, CKD. What does it mean? What is the way forward? Somebody is asking, Sabi doctor, okay, all these things you have said now, what is the way forward? Me, I don't want to suffer kidney failure because I know kidneys are very expensive. Yes, they are quite expensive. They are quite expensive. Kidneys are expensive, all right? So if you don't want to be in a position where you have to look for somebody to donate kidney for you. The person has to love you really for them to donate their kidney, especially if you don't have money. I know some people are into the practice of giving kidneys for monetary gains. All right, but that's another topic entirely. So what's the way forward? Next slide, please. The way forward is prevention. I always say this. Prevention is the best medicine. Not laughter. Some people think laughter is the best medicine. No, prevention is the best medicine. And when it comes to prevention, as it pertains to kidney health, there are 3 levels of prevention. Can we go to the next slide? There is primary prevention, there is secondary prevention, and there is tertiary prevention. Doctor, wait first. You are going too fast. What does this mean? Primary prevention is when you don't have the disease condition, so your kidneys are working perfectly fine. You don't want to ever be found needing a new kidney or needing dialysis. You want to forever banish kidney disease. That is what we call primary prevention. Secondary prevention, on the other hand, you have messed up with it. So some kidney damage have already started, but you want to catch it at the earliest stage so that you can prevent further progression of the disease. The disease goes through about 5 stages. Healthy, then stage 1, stage 1 is healthy, stage 2, stage 3, stage 4, and then you get to stage 5. So there is still room for secondary prevention and even tertiary prevention. Tertiary prevention, your pool has hit the ceiling, things are really, really rough, but then you still don't want to suffer fatality. All right, so that's where tertiary prevention comes in. So let's look at primary prevention. What does it entail? Number 1, the next slide. Next slide, please. Next one. Forget about this. All right, hydration. So you have to drink a lot of water. Adequate well, hydration is important. Adequate physical activity. I've already explained about 150 minutes of exercise weekly. You can split it out into 30 minutes daily for 5 days, or you can do 75 minutes of vigorous activity once per week. You need enough sleep and rest. Against Lagos people cannot relate. You need to improve your intake of veggies and fruit. Very important. You need to limit salt intake. You need to limit alcohol. You need to limit your intake of sodas and energy drinks. Now, the thing with alcohol here is if your kidneys are still fine, your liver is fine, you might still can still take on and off. There is a safe limit for that. I'll show you soon. But if your kidneys are already bad or you're already having liver problems, please just avoid it. Don't be saying something can kill a man. We know something can kill a man, but must it be kidney failure that will kill you? Except maybe you desire for kidney failure to be the cause of death. Anyways, reduction of NSAIDs, non-steroidal anti-inflammatory drugs, your what do they call it, diclofenac. You want to be very careful. And to this end, I want to emphasize the importance of this point as it pertains to women. Sometimes they use these drugs for their periods and they are prone to abuse. They are prone to abusing the drugs because of how effective they can be with managing menstrual cramps. So be very, very careful. Make sure you don't overstep the prescribed dose from your doctor. Reduce stress or manage stress. If you are in a very toxic environment, please find a way to remove the stressor or just remove yourself from that environment. Manage obesity. People who are obese are more likely to develop diabetes, hypertension, which are risk factors for kidney disease. No secrets. I wish I had enough time to really emphasize on some of these points. But again, be careful with bleaching. Some of you want to bleach, but the creams are not they are not premium from premium brands. Their quality is poor. They load them with mercury and hydroquinone. These are things that can eventually damage your kidneys long term. Drugs. Those of you who do Molly and the likes, you know them. You know these drugs. Please be very careful. Be very careful. I foresee a future where Nigerians are going to battle with a lot of kidney and liver problems. Young Nigerians in 20s, 30s, they are really into these things heavily, you know. So that's why you also see that previously you are seeing people in their 50s, 60s, 70s coming down with kidney problems, but now people in their 20s, their 30s, they are having it. Stop holding your urine for too long. I beg you. It can predispose you to urinary tract infection, which can indirectly affect your kidneys. Secondary prevention, early detection, go for screening regularly. And if you discover a condition, start prompt treatment. Of course, you also want to reduce salt intake, NSAIDs. You want to be very careful with your consumption of red or processed meat. And if you have blood pressure problems or diabetes, optimal control is extremely important. Optimal control is extremely important. So this is the stage of where the disease, you've caught it early. You can still do so well if you can control the progression, all right, because you caught it early. If you let it get to the last stage, which is end stage renal failure, that's when it becomes a problem. You definitely need dialysis or kidney transplant. Now, for tertiary prevention, things are really bad. Things are not so good. Probably you are going to stage 4 or stage 5, and things are quite bad. What are you going to do? It's more palliative care. Well, let me not say palliative care. With dialysis and kidney transplant, you can still pull through. But again, no matter how bad it is, we want to delay the commencement of dialysis and renal transplant as far as possible. We want to delay it for as much as possible. All right, because once it gets stage, things just really look bad. Not many people can afford weekly dialysis, let alone being able to afford the cost of kidney transplant. All right. Anyways, with these explanations, I want to believe that no sacrifice is too big to make for your kidneys. And with this, ladies and gentlemen, I want to thank you for your audience. Again, apologies for the earlier hiccup with pulling up the slides. I don't know if I have time to take questions. Isn't it? Do I have time for questions? I saw that quite a number of people dropped questions in the chat
Yeah,
box.
all right. Okay, thank you
Okay.
very much, Sanito. That's quite an insightful presentation. I'm sure the comment section is already filled up with a lot of questions for you, but we will be taking the questions after the second presentation. And
Okay.
I can relate with something you said towards the end of your presentation. You said no sacrifice is too big to make for your kidney, and that's quite something to note. And so going on to the second presentation, we have with us Dr. Aderemi Adilaja. Dr. Aderemi Adilaja is a senior consultant in internal medicine and nephrology at the prestigious St. Nicholas Hospital, Lagos, Nigeria. He is a fellow of the National Postgraduate Medical College of Nigeria, an erudite scholar, an amiable clinician with special interest in the area of preventive nephrology, acute kidney injury, especially in critically ill patients, interventional nephrology, hemodialysis, and kidney transplants. Please, can we have Dr. Aderemi Adeleja with his presentation? You have the floor, sir.
Thank you, everyone. And thank you, Dr. Damian Haver. No doubt he has done a lot of justice to the discussion this afternoon. And I think I will have very little to add more to what he has said so far. I say thank you again, Dr. Haver. Thank you very much. Can my slide be put up?
I present
Is that what?
I present a value.
Thank you, my brother. I appreciate. Well, this is the little me. I'm Dr. Aderemi Adelaja. I'm a consultant physician nephrologist. So can I have my slides, please? All right. It's not coming up yet. If you want me to start, let me know. I can start. No problem putting it together.
So you can go ahead. You have 20 minutes for your presentation. Thank you.
Okay. I will try as much as possible. Thank you, everyone, for listening and for being part of this presentation. So I'll be talking about maintaining functional kidneys. Like the earlier speaker have said, he has actually delved much into this topic. Now, kidney problem is actually a global public health, and it affects over 50 million persons worldwide. Well, the body of kidney disease, we must understand, it varies from one part of the world to the other. And I think the meat of this discussion is early detection, prevention, and treatment. Evidence also suggests that developing countries like Africa, Sub-Saharan Africa in particular, and some other parts of the continent have similar or even greater kidney disease burden. Next slide, please. Next slide. Anyway, now the kidneys, as we've earlier been told, is a tube-shaped organ retroperitoneally located, and the kidney is composed of 1.5 million, which actually serve as a functional unit of the organ. It helps to filter waste, it helps to balance water and salt, it helps to regulate blood pressure, and the rest. Next slide. No, next slide. Okay, thank you. Now, the kidney disease we're talking about can be acute or it could be chronic. The acute is regarded as kidney disease that is potentially reversible. That means the kidney disease can be pushed with adequate prompt treatment. It can actually be reversible if it occurs or goes on for less than 3 months. But for those which has continued over 3 months, they are usually regarded as chronic kidney disease. And like my earlier speaker have said, We have stages 1 to 5, depending on the severity. Now, the acute kidney injury is potentially reversible, but even significant percentage of those people who come down with acute kidney disease can progress to becoming chronic. Now, both are quite common, particularly in persons of African origin. The black kidney is particularly prone to suffer the kidney complication of many conditions. Like we go on, we will be able to explain further. Conditions that frequently lead to kidney failure are common in our environment, and the condition may be only mildly symptomatic in the early stages. So many people can actually go on without knowing they have any kidney problem. Next slide. Okay, this picture just depicts the per million population in terms of prevalence. You discover that if you look at those numbers, this looking at pictorial representation of people with chronic kidney disease in the population. You can see that the early stage is stage 1. You can see the number per million population, people that are there already, you know. So what we're actually, by the time a person gets to stage 5, a lot of things will have happened over time. Let's go on because my time is very short. Next slide, please. I will be speaking to this later. Now, in the past, treatment efforts are focused on preparing for and delivering kidney replacement therapy. So it's not just about treatment, that was in the past, but now we have, because of the new development, new research, we have new therapeutic breakthrough. However, often which offer opportunities to prevent or delay diseases and mitigate complications such as cardiovascular disease, kidney failure, and ultimately prolong quality of life and living at the same time. Next slide. Barriers. What are the barriers? Next slide, please. What are the barriers to access this new therapy? One of them. Hello, next slide. Okay, maybe I will continue if you can make me up. Well, can I continue?
Yes, sir, please continue.
The slide is off. Okay. Well, there's a lack of awareness of the existence of chronic kidney in a lot of our population, insufficient knowledge of the newer treatment strategies. There's also lack of confidence with newer therapies. And then no thanks to JAPA, a lot of our specialists are no more in the country. We are losing doctors on daily basis, and therefore there is high attrition rate, not just for specialists in kidneys, other specialists and other younger colleagues. So, and then of course, the cost of kidney therapy is quite huge. You know, in this part of the world, a lot of these treatments are done out of pocket. A lot of insurance doesn't cover most of the treatment plan, and therefore, we all know what we're going through in Nigeria today. Now, what is the global view about chronic kidney disease? The global burden of disease studies as at 2021 shows that chronic kidney disease is number 8, is the 8th leading cause of death worldwide, even ahead of tuberculosis, which is number 13, and HIV, which is number 14, and even malaria, which is now number 21. So I'm trying to sensitize you to know that we have a lot of problems in our hands. It was also the 6th fastest growing cause of death between 1990 and 2017. And come 2040, it's been projected that it will be the 5th most common cause of death globally. CKD risk factors, well, 1/3 of the global population is at increased risk of CKD because they have one or more of the risk factors associated with this condition. This includes high blood pressure, like we have actually been taught earlier, diabetes, obesity. A lot of people are doing smoking and just not smoking cigarettes, smoking different substance. When you are older than 60 or over, you are also at higher risk of chronic kidney disease. Then probably you also have other established cardiovascular disease, or you have a family history of chronic kidney disease, or you have, or that you also belong to some ethnic group. There are certain factors there that actually contribute to the high incidence or prevalence of this illness. Or you have had the history of acute kidney injury before, which is potentially reversible and you got better. Like I said before, 10% or even 10% of people who comes down with acute kidney injury progresses to chronic kidney injury. Even those people that fully recover from the initial kidney assault will progress to having chronic kidney disease. Now, there's a picture I'm about to put up, but it's not showing on the slide now, that 1 out of 10 people you see are having some form of chronic kidney disease, adults. And then you also discover that according to WHO statistics, 10% of the population worldwide are affected by chronic kidney disease. Half of people aged 75 and above have some form of chronic kidney disease. And 1 out of 5 men, or 1 out of 4 women above the age of 65 have chronic kidney disease. Now, if you look at the sub-Saharan Africa where we all belong, the prevalence sometimes goes, you can have passed this slide, so you can actually, I'm on the epidemiology of chronic kidney disease now. I think that's number 13 slide. Not this one, next. Okay, next. Okay, now what are the global challenges of programming risk factors for causes and progression of chronic kidney disease? There are modifiable and non-modifiable. Please go back to the well, global challenges, risk factors for causes, and yes, thank you, and progression of chronic kidney disease. There are non-modifiable causes and modifiable causes. So, for example, if you are an African or a Black African American, you have a higher chance of coming down with chronic kidney disease. So, genetics, yes, there are certain genes as common in Black or Africans that have been attributed to the higher incidence or prevalence of chronic kidney disease. Males are generally more at risk. Your age, like I said, above 60, you are likely to be, and these are non-modifiable factors. Other modified factors include diabetes. Worldwide, you know there is about 1 million as a 2000, and by 2030 we will have more people who are diabetic. About 366 million is being postulated. For hypertension, yes, it's a very common cause of chronic kidney disease. Infection like HIV, obesity, hyperlipidemia, smoking, poverty, social deprivation are all identifiable risk factors for chronic kidney disease. Like I said, the inheritance of APOL1 gene, like I said, poor access to health care, illiteracy, ignorance, poverty are all reasons why Africans are more prone to having chronic kidney disease. Next slide. There are certain other causes of chronic kidney disease that actually are unknown. You know, after, as a doctor, you interact with the patient, you ask about these, about maybe common factors. There are a group of these causes which we refer to as chronic kidney disease of unknown origin. That's what the acronym of CKDU, of known origin. Kidney disease in the absence of past history, the patient is not diabetic, has no chronic or severe hypertension, has no form of glomerulonephritis, no form of obstructive nephropathy or obstructive uropathy, anything that can predispose. You can identify any. So some people can actually have it. So, and it's also common that if you live in this area, a particular kind of area where this disease entity exists, in another 10 years, you're likely to come down with it. And some of the X-ray features, you just discover that on the scan, the two kidneys are echogenic. Renal biopsy, sometimes we help resolve some of these puzzles. Now, there is also some causes we call CKD of multifactorial origin or causes. There are some of these chemicals I'm going to be mentioned. Agrochemicals, people are involved in the manufacturing or the use of some of these chemicals. They are not low. That's why it's very important to emphasize on the prevention. If you find yourself in this kind of environment, don't let this chemical come in contact with your breathing. You have to use the proper preventive wear. The aristocolic acid, some of these acids are present in some spiritual spices that's being used in some religious cycle. They can predispose to chronic kidney disease, heat, stress, dehydration. Earlier speaker emphasized things about water intake and all that. Add water, fluoride, low socioeconomic factors, mycotoxins from food, viruses, unhealthy lifestyle like alcohol, abuse of handset, and then some genetic predisposition. Now, my earlier speaker, next slide, please, also talked about women. I think my time is almost up. Talked about women with there are a lot of chemicals outside now, a lot of aphrodisiacs in form of chemicals, in form of capsules, drinks that people are using. There are a lot of, that's for men or women, both. There are so many creams for this and that people apply. Sometimes you'll be amazed about the number of chemicals in a little cream or in a little pomade or in some soaps. And these are absorbed through the skin, and some of them contains mercury, and some of them can actually damage the kidney on the prolonged use. Well, these are few slides talking about a few studies that have been done previously in Nigeria showing prevalence of CKD as of 2011 to be about 11.4% in the study, in the community studies. In the Northeast, for example, by Professor Nwankwo et al., we have a higher incidence, about 17.8. I'll be able then when you look at, okay, I don't think I need to talk about African assets because we talked about variation in different regions of the world. Next slide, please. About the political awareness, political well-being, and all. Next slide, please. I'm ahead of this slide you're projecting. Next slide, please. Yeah. In terms of wealth, and that we also know, people say health is wealth, but sometimes you can also turn it the other way, that health is wealth. Because discover that countries that have higher GDP per capita have better health system, and therefore some of these diseases can be early detected. People have access to healthcare. People are treated and all that. Let's go on, please. Let's go on. The next slide talks about Nigeria has the largest extreme poverty population as of June 2018. And you can see this is even ahead of India. Now, next slide. Modifying. Now, the emphasis, like I said, if there is an established chronic kidney disease, depending on the stage, I'm going to try and rush up now. There are certain important things the nephrologist or the physician will emphasize. One of it is strict blood pressure monitoring. Depending on the cause of the CKD, depending on other and I must emphasize here that no two patients are the same. So there should not be any confusion about the drug of choice your nephrologist is making over the other. And I'm speaking to all the specialists because we're going to be interacting. For example, somebody who's diabetic will come to the nephrologist by the time he develops diabetic kidney disease and all that. So there are no single patients are the same. So your doctor will look at your drugs, will look at the other things like what is happening to the kidney, what's happening in the urine, what other cardiovascular risk does the patient that poses danger to this patient, and that will modify the approach your doctor will use in managing you. So but the most important thing that your blood pressure has to be well controlled. There are drugs that are very good when somebody that have been that are of advantage when it comes to management of chronic kidney disease. These are ACE inhibitors, angiotensin converting enzyme inhibitors, or the ARB. Cholesterol and the lipids have to be controlled. The sugar has to be controlled. You have diabetic, low protein diet. My brother has spoken much about that. Avoid nephrotoxic agent. Nephrotoxic agent is not just some of the chemicals or the marijuana or the drugs I've talked about. What of all those ones are being sold by the side way that people talk about for your back to be spreading or jadi, all those. There are so many at the bus stop. There are so many at the car park. There are so many on the streets that people mix with different things. So many of these things are also nephrotoxic. Lifestyle adjustment, if you are smoking, please stop. If you are taking alcohol, I will advise that you stop. Well, the use of statins, there has been a lot of debate about that. Timely treatment of chronic kidney anemia is also important. However, it's a specialized thing that we need for nephrologists to manage because most people that have chronic kidney disease have low blood level, which is generally referred to as anemia. Now, how to detect chronic kidney disease? Well, I must emphasize at this point that most times when people have chronic kidney disease, remember that pictorial representation of the iceberg that just showed you, that by the time you are seeing the tip of the iceberg, a lot of things have happened before now. So people can actually move around without knowing that they have chronic kidney disease. But by the time you are seeing an individual coming down with signs and symptoms of chronic kidney disease, I can tell you that 50 to 90% of the kidney function of both kidneys are gone. So this emphasizes about prevention and early detection. So it's important that it should be basic tests like checking the urine is very vital when you go to the hospital. We need to check our blood pressure, blood sugar regularly. Signs of advancing chronic kidney disease could also include the swelling, the fatigue. Sometimes they're just weak all the time. You don't know what is going on. The appetite is not good. And when you go to the toilet to eat yourself, your urine is foaming. This can also be a pointer to early warning about chronic kidney disease. Next slide, please. Golden rules to reduce the risk, like my brother said, Dr. Abba said, keep fit, active, regular exercise, 30 minutes of brisk walking 5 days in a week is fantastic. Keep regular control of your blood pressure, sugar level, monitor your blood pressure, eat healthy, keep your weight in check. If you are obese, maintain a healthy fluid intake, do not smoke. You see, another thing I must emphasize when I say eat healthy, and I can tell you, I can bet you that eating healthy does not mean you have so much money. Of course, the problem is that when we talk about eating healthy, people think eating something too expensive. No, just your fruits, your vegetables, your little carbohydrates, your low protein diet, avoiding red meat, cutting down on red meat, taking white meat, especially your chicken, your birds. Generally, they are fantastic. Fish generally are good. Dr. Haber has mentioned some other fish we need to avoid. These are better diets to prevent chronic kidney disease. Other things I must say here is that get your kidney function checked if you have one regularly. If you know you have all the risk factors, you have family history of hypertension, diabetes, or chronic kidney disease, you might probably be at higher risk. So you need to do some checks at least twice a year. Next one is these are just like the next slide, please. I think I'm rounding up now. We keep fit, be active. Next slide, eat healthy diet. We call some things DASH diet in terms of sodium intake, so that's salt intake. You see, if you're hypertensive, let me just put it in a very layman's explanation here. If you're hypertensive or diabetic or chronic kidney disease, how do you measure your salt? I keep telling people, a lot of my patients ask me this question, and I tell them, this is how you go. Apart from avoiding to eat outside or eat in another place where you cannot determine and tell them this is the amount of salt you put in my food. I'll tell you, if you're at home and you're cooking, not that you should go completely out of salt, but if you are married, for example, and your wife cooks the food and adds salt to your food, if somebody is not hypertensive and who have ID taste out of that food and can feel that there is salt in this food and it's enough or too much, that means you are taking too much. That's the cutoff I give to people. That's the little explanation I can give, because we're talking about 5 to 6 grams of salt or sodium per day. That may be difficult. But then, if somebody beside you taste your food and can tell you that, okay, this food is okay with salt, that means you are taking too much already. Thank you. Next slide. Oil check and control your blood sugar, check and control your blood pressure. Take appropriate fluid. Next slide, please. Don't smoke. We've talked about that. Don't take over-the-counter anti-inflammatory drugs or painkillers. That has done a lot of damage to people. With the stress of Lagos, with the stress of the cities, with the stress of bone pain, menstrual pain, and all headache and stress, people tend to take a lot of NSAID, painkiller. There are examples which I don't want to be mentioning for advertisement sake, but those ones you have to make sure you are guided by the use of those drugs. If not, chronic use of some of these pills can predispose you to a lot of kidney damage. Next slide, please. Get your kidney function checked, like I said earlier, if you have one or more higher risk factors. Next slide, I've gone beyond this slide that is being projected. Stress management. Next slide. Next slide. Yes, stress management. Yes, Dr. Hava has mentioned some techniques of stress management. Part of it is also resting. I know it's tough in Lagos, sometimes in the cities where you have to walk. I mean, okay, yeah, anyone slide already. But let me just emphasize that the stress management thing. It's good to have 6 to 8 hours sleep. But I understand very well that people have to move, sometimes have to wake up very early and be at work very early too, and then come back home very late. So, what my brother and sisters, please, I want to appeal to you, try and get enough rest. Take some deep breath when you're under a lot of pressure. Talk to experts if you have some stress, emotional problems. Don't just don't just buckle up your stress all alone. There's a lot of people who are depressed. Talk to the expert, please. Share it with your loved ones and let them give you a helping hand or a shoulder to lean on. Thank you very much. Thank you for your time.
Thank you very much, Dr. Adelaja. That's quite extensive. I know kidney is quite a broad topic, and if we go on and on and on, we might not be able to exhaust all you know about kidney today. Thank you very much for taking out your time to teach us
You're welcome.
how to maintain our kidneys. And so we move over to the questions. Again, being that in recent time, we have several young adults who are coming down with kidney issues, kidney failure, kidney stones, and a whole lot of that. And that is what made us to choose this wonderful topic on a day like this. And so over to the chat box. And like I said earlier, please, if you have questions, feel free to drop it at the chat box and have your questions attended to. Also, feel free to follow us on all our social media platforms, on Twitter, Instagram, YouTube, and on Facebook. We are there as Sunlab Nigeria. So one of the questions says, is kidney illness hereditary? If a person in the family gets diagnosed of kidney failure, is it a concern for the other members of the family?
You want me to answer that question? Can I give it?
Yes. Yes, go ahead, sir.
Yes. Kidney occurrence in any family should be of a concern because things like diabetes, like hypertension, have been linked to cause of chronic kidney disease. And you must also understand that some of these common causes are also linked to certain genetic predisposition. That is one. Number two is the fact that there are certain genetic causes of chronic kidney disease. For example, we call something polycystic kidney disease. You have the juvenile type, you have the adult type. You understand? Which are linked to certain chromosomes, like chromosome 16, for example, for the adults. And when it occurs in the family, the siblings or the direct siblings of the individual, for example, if the man has it, the children are also likely to have such. And adult polycystic kidney is a common cause of end-stage renal disease, which is a form of chronic kidney disease. So it's of concern. And like I said, if you're living in that environment, what are those predisposing factors to some of these things we call diabetes? Because you're living in the same environment, so you're likely to be predisposed to such. So that is the way to look at it.
Okay, thank you very much. We have another question here talking about kidney stones. Sabi Doctor would like you to throw more light on how kidney stones are formed and how it can be prevented as well. Thank you.
So there are, when you are considering kidney stones, there are several factors, all right? So, and by the way, there are also several types of stones. Now, I want to believe the person is, or I suspect the person is considering kidney stones with respect to lifestyle, like what lifestyles can, predispose one to kidney stones, which of course we have to go back to our previous point made about hydration. So if you are not adequately hydrated, you are not taking enough water, you give room for stone formation through the passage of concentrated urine. All right. And of course, people who eat a lot of high protein diets, like a lot of protein diets, are equally more prone to kidney stone formation. Like I said, there are different types of these stones, different factors. So for example, there are some people, for example, who have like sickle cell anemia. There are certain kinds of stones they are more prone to having. So again, it depends on the risk factor you are considering. But as it pertains to behavioral lifestyle, I would advise that you hydrate adequately. You also pay attention to your consumption of meat. Now, there is another thing I think I should mention. This I don't know if it's I still don't understand the behavior yet, but there is this newfound crave for supplements. So people take vitamin C, they take all sorts of supplements. Well, those might not necessarily be a problem, but there are certain vitamins that it's possible for you to overtake them and they can predispose you so you are taking too much of vitamin C. It can as well predispose you to stone formation. All right. So to that end, that's what I can say. Just be very careful, hydrate adequately. Um, be watchful of your diet, particularly if you have had a case of maybe stone formation previously. You have to be very careful of your diet as well.
Okay, thank you very much for that question. Please, before the end of the webinar, we'll have a feedback survey pop up on our screen. Please, we appreciate your feedback on this webinar. And so another question to you again, Sabi Doctor, because you made mention of protein requirement, someone wants to know what is the protein requirement for an adult, and again, the protein requirement too for a patient with end-stage kidney disease. Sabi Doctor, please.
So for people who already have some degree of kidney compromise, there's a term they use, they call it renal diet. So essentially you want to be on diets that are low in sodium, which is salt. You want to be on diets that are low in phosphorus, and then diets that are low in protein. Now, the preference when it comes to animal protein is to go for proteins that are lean. So your chicken, which is lean protein, lean animal protein, it's good choice. Egg is also equally not bad. Then you can also consider plant sources of protein as well. Usually the problem comes from red meat, especially red meat that has been highly processed. That's usually when, so if you are eating a lot of shawarma with all those their meat and the likes,
Okay.
that's a problem. All right. But in any case, usually if it gets to the stage where you need some form of dietary restriction, a dietitian should be assigned to you to prepare a meal plan, because even some of these proteins that may be considered maybe safe, there are portion depending on the level of degree damage that may not be safe. So you still need a dietitian to help plan and apportion the volume that is safe for you to consume. So I think there was another question. Which other one? I think I missed one.
Yes. Um, The protein requirement for a patient with end-stage kidney disease.
Okay, so I just there was one before this one. I just answered this one.
Okay, the question is on protein requirements. So the first person was
all right.
asking what is the protein requirement for an average adult?
Okay, the protein requirement. What's it again? I mean, the daily requirement has skipped my mind. All right, but usually, except maybe the person is really over consuming protein, it shouldn't be. You shouldn't get to a stage where you have to begin to worry whether you are consuming over consuming. All right, but there is a daily requirement which the number I can't pull up right now from my brain. Okay,
Okay,
maybe I'll have
okay,
to
thank
look
you
that
very
up.
much.
Yes.
Okay, thank you for that. Dr. Adilaja, someone has a question here for you. Person says, what are those control measures to help avert the effect of kidney disease, particularly for Lagosians who undergo stress on a daily basis, knowing fully well that over-exercise has its own effect on the kidney?
Well, thank you very much. The person is talking about what can be done as a result of what cannot be avoided. You are in the
Exactly.
traffic, you're stressed, and all that. Well, I would advise you need to take enough rest. Weekends, if you have been stressed from Monday to Friday, for example, you are sure you have not had adequate sleep, weekend should be for some kind of rest. You understand? So that at least you can have some revitalization. You have to eat healthy. That's another problem because it's not just the stress, it's about work. You can't cook before you leave, so you have to buy things anywhere you eat. You understand? So that's an important thing I must say. And then because of sedentary lifestyle, depending on your kind of work, people sit for like 6 to 8 hours, from 8 to 5, or from 8 to 4 doing. You should please take time to stand up from your desk, walk around, and then you come back and continue. You understand what I'm saying? Because you must have some people drive. So driving from your maybe from the highland to the mainland or vice versa for 2, 3 hours, then you sit down for another 6 to 8 hours, and then before you know it, you get home, you just take your bath, and then probably you sleep. Or some people have their dinner at late at 10, 11 before they go to bed, and by 4 they are up. So you have to just look at that. You avoid late eating because that has a lot of metabolic problems you can get from that. Make sure you are hydrated. Make sure you take rest when you need to take it. That's
Okay,
what I
thank
can
you.
just say.
Okay, thank
Yeah.
you very much for the clarification. The feedback survey poll is now on our screen. Please do well to help us answer, as it will help us in getting the next content for our webinar. And so before we go, Sabi Doctor, you mentioned about people should avoid taking alcohol. But someone here has a question which says, what about red wine? Because if you say we should avoid alcohol entirely, how can we relax after having a stressful day? So someone wants to know whether intake of red wine also have adverse effects on the kidney. Sabi Doctor, please.
Okay, so that's a good question. Thank you to the person who asked it. Well, like I mentioned, there is unlike cigarettes, there is a safe window for alcohol. All right. Usually we say that uh, the average female adult who does not have any health challenges that forbid alcohol can take a standard drink per day, while the healthy adult can take about 2 standard drinks per day. So the question now is, what qualifies as a standard drink? A standard drink will mean that if you are taking beer, that will be one kind of beer. So the woman takes one can of beer per day, that's fine. The man takes 2 cans maximum, that's fine. All right, so you can multiply it by the number of days in a week to know the safe limit. So that's for beer. What about wine? Because wine has about 12% alcohol, right? So for wine, they say that you should do a glass of wine, which is around maybe 150 mils, the volume. So 1 glass of wine for um, qualifies as one standard drink. So that's 1 glass for if you are doing wine, whether red or white, The woman takes a glass per day. The man takes no more than 2 glasses per day. Then if you are doing vodka, ogogoro, yes. If you are doing that one, the the recommendation is that one standard drink for that one is about a shot of the drink, so which is about 1. So if you multiply, it gives you about 45 mils. So that's just a shot of your vodka or your which other one? I don't drink alcohol, so I don't know I shall know there is vodka. I know there is it
Okay,
red label?
I know there are sachet ones, the
Yes,
bitters and
exactly,
the
exactly. So you have to be careful. Don't just exceed the required limit. For those who have well-functioning kidneys, their livers are fine. All right.
okay.
If you are in the state where you already have some level of liver compromise and kidney problems, I would just advise you to completely abstain from alcohol. All right. I don't think
Okay.
is what you know. Although some people have mentioned that perhaps maybe red wine might offer some benefits to the heart, but even then, there's still a bit of some schools of thought believe that that benefit is eventually erased when you consider the potential side effects.
Okay, thank you very much. So just before we go, the survey is on our screen. Please help us in giving feedback. So, Sabi Doctor, the final one, are there blood tests that one can do to check their kidney function? And how often should individuals do this check?
Yes, I believe my chief has already emphasized the test, but let me just reel them out again. So there is what we call kidney function test. So that kidney function test, to a very large extent, you know, is a test that tries to assess your kidney function and state of health, and it involves tests like EUCR. By the way, somebody was mentioned. So I saw a question. Somebody asked the correlation between EUCR and hypertension. Well, hypertension can cause kidney damage. So EUCR can give us an idea of how well your kidneys are doing. We look at the creatinine, we look at the electrolytes, we look at electrolyte urea and the creatinine. All right. So yes, you can do your kidney function test. What I usually advise my audience on Instagram and elsewhere is that set aside a day of the year, preferably on your birthday. That's what I've always tried to teach them. So on that day of your birthday, just use that particular celebratory mood and go get yourself a body checkup. Look at your kidneys, do kidney function test. You can do urinalysis, and depending on the findings, you can investigate further. But at the very basic level, kidney function test, urinalysis. All right. Yes.
Okay, thank you very much again, Sabi Doctor, for availing us this opportunity and for sharing knowledge on kidney health and how to keep a functional kidney. Again, those tests that you mentioned are well accessible at SynLab Nigeria. You can actually access this test via our e-commerce platform, www.synlab.com.ng, or you can as well walk into any SynLab location all over the country to have your kidneys tested. I'm sure we are at the end of this webinar. Thank you so much, Dr. Adilaja and Sabi Doctor,
Thank
Dr.
you.
Damian
Thank
Eva,
you.
for finding time to have this wonderful, inciting, and engaging presentations with us. We really, really do appreciate. Thank you very much to everyone who joined this webinar. And please feel free to follow us on all our social media platforms, on Twitter, on Instagram, on Facebook, and subscribe to our page on YouTube as SynLab Nigeria. Thank you very much. See you all next time and enjoy the rest of your day and your weekend at large.
Thank you.
Bye.
Thank you for the quiz. Thank you.
Thank you.
Bye.
Nice to meet you, Chief.
Thank you. Yeah, thank you, my brother. We talk
Yes.
later, please.
Yes.
I'd like to have it.
Yes.